Are you looking for professional training in forensic mental health?
We'll talk about those kind of common tests and maybe some of the less common tests. And a lot of tomorrow we're going to spend focusing on the kind of broader issues. So we're going to talk about some of the cultural issues, what tests we can use in different cultural contexts, which ones are stronger than others. We'll talk a little bit more about integration of tests. So one of the things that's increasingly contentious is just making decisions. You're going to see a lot of names of a lot of tests. How do you decide which ones to use? How do you decide how many to use? What do you do when you've administered 5 tests and 3 of them point in one direction and 2 of them point in another direction? Is it just majority wins? Is there some other strategy? So we'll talk about those strategies, and we'll talk about using the tests as part of a broader clinical strategy, because at the end of the day, the tests don't testify for themselves. There will be instances where an MMPI is extremely elevated, but our clinical impressions and the history that we have and all the other available data at our disposal suggest that this person is in fact genuinely psychotic, and there's no real evidence that they're exaggerating their symptoms. We've done a clinical interview. They're psychotic. Their symptoms are plausible. They're on an inpatient unit in Elmhurst. Everybody that sees them 24/7, round the clock, says, yeah, this person is crazy. All the family describe a consistent pattern of deterioration over the months leading up to the hospitalization. There's all sorts of collateral evidence to support that these are genuine. Everything points to this is a person with serious symptoms. But the MMPI, eyes open, eyes closed, extensive training, or novice, anybody would look at the MMPI and say, oh, this is clearly exaggerated, right? It's an F scale of 110. What do we do?
To learn more about Concept's professional training opportunities, visit us at concept-ce.com.